Hey everyone, and welcome to our deep dive. Today we're going to be tackling a topic that might be on your mind, especially if you're an older adult or have loved ones who are, and that's mild cognitive impairment, or MCI,
hmm
that kind of gray area where your memory and thinking might not be as sharp as they used to be,
Right.
but it's not quite full-blown dementia either. So we're going to really get to the bottom of this using information straight from the Mayo Clinic. They have some really good stuff on their diagnosis and treatment page, and also their symptoms and causes pages. So
Yeah, it can be really subtle,
yeah.
and hard to even tease apart. Like, is this just normal aging? Is this something more? And there's no one test that can definitively tell you yes or no.
So it's more like a puzzle. That
Yeah.
how do doctors even start figuring out if someone has MCI?
It's a lot of detective work, right? So
Mm.
they'll take into account your medical history. Maybe family members are noticing some changes in your behavior or thinking, and then there's some tests to rule out other conditions that could be causing similar symptoms.
Okay, so like what kind of tests are we talking about here?
Well, there's the neurological exam, which, checks your reflexes, your coordination, your balance. They might do blood work to look for things like vitamin deficiencies or thyroid problems that can actually affect thinking. And sometimes they'll use brain imaging, like an MRI, to see if there are any structural changes going on in the brain.
Okay, that sounds pretty thorough. Is there like a specific mental test too to assess memory and thinking directly?
Absolutely. There's a mental status test where they're evaluating things like your memory, your language skills, your attention span, how well you can solve problems. And actually, to keep things standardized around the world, doctors use these internationally recognized criteria to make the diagnosis.
Also, it's not just subjective then. Like there's some standards in place. That's good to know. But here's where I get a little confused. If someone with MCI can still handle their everyday life,
Hmm.
how is that different from dementia? Isn't that kind of like the defining characteristic of dementia, that you can't function normally?
You've hit on a key point there with MCI. You might be forgetting appointments, misplacing things more often, having trouble finding the right word, but you can still manage your daily activities without major problems. Dementia is when those impairments become so severe that it really impacts your ability to function independently.
Okay, so it's more about the degree of impact on daily life that makes sense.
Mhm.
So, I'm kind of picturing like shrinking down almost like in that movie Fantastic Voyage.
Yeah.
And like getting inside the brain, what's actually happening at a microscopic level in someone with MCI.
Imagine this, right? You're zooming in on the brain and you start to see these tiny clumps of protein forming almost like knots and tangles in the brain's wiring.
Hmm.
And these things have names like amyloid plaques, tau tangles, and sometimes Lewy bodies. They all kind of get in the way of that smooth flow of information in the brain.
Wait a minute. Those names sound familiar. Aren't those also hallmarks of Alzheimer's disease?
That's right. Those protein clumps are definitely a characteristic of Alzheimer's. However, in MCI, these changes are less widespread and less severe. It's kind of like the early stages of a process that might, in some cases, lead to dementia.
So it's not a guarantee that if you have MCI, you're going to develop Alzheimer's.
Exactly. Not everyone with MCI progresses to dementia. Some people stay stable for years, and some even see their cognitive function improve.
Well, that's reassuring to hear. But let's talk about who might be more likely to develop MCI in the first place. I know age is a big one, right?
Age is definitely a major risk factor. The older you get, the higher the chances, but it's not the only thing. There's also a gene called APOE4 that can increase your risk. However, even if you have this gene, it doesn't mean you're destined to get MCI.
So it's like a predisposition, but not a guarantee. What about our lifestyle choices? Do those play a role in brain health and the risk of developing MCI?
They absolutely do, and this is where it gets empowering because you actually have some control over this. I think of it like a coin with two sides on one side. You have things that increase your risk, like having diabetes, smoking, high blood pressure, being inactive, and even having untreated depression.
And on the flip side, what can we do to potentially lower that risk?
The good news is a lot of those risk factors are modifiable. So you can choose to eat a healthy diet, get regular exercise, stay socially engaged, keep your mind active, manage any health conditions you have. All of these things can protect your brain.
So it's really about making smart choices to kind of stack the deck in your favor. Can you give us that quick rundown of things people can do to actively protect their brain health?
Sure. So aim for a heart-healthy diet like the Mediterranean diet. Lots of fruits and vegetables, whole grains, healthy fats. Make physical activity a regular part of your routine, whether it's brisk walking, swimming, dancing, whatever you enjoy, and then keep your mind stimulated by learning new things, doing puzzles, or engaging in creative activities. And don't underestimate the power of social connections. Stay connected with loved ones, join clubs, or volunteer in your community.
It sounds like a really holistic approach, taking care of your physical health, your mental health, your social well-being.
Mm-hmm.
It all works together. Now, let's say someone has already been diagnosed with MCI. What can be done to treat it?
Well, this is a field that's rapidly evolving, and there's a lot of promising research happening. One exciting development is that there are now FDA-approved drugs for Alzheimer's disease, like lecanemab and donanemab, that are being explored for their potential to slow down cognitive decline in people with MCI.
Wow, that's cutting-edge stuff.
Mhm.
Are these drugs considered a cure for MCI or Alzheimer's?
It's important to manage expectations. While these medications offer hope, they're not. A cure research is still ongoing, and we need more data to fully understand their long-term effects and potential benefits.
So not a magic bullet, but definitely a step in the right direction. What about for people who might not be candidates for these new drugs or are looking for other options? Are there non-drug approaches to managing MCI?
Absolutely. In fact, lifestyle changes can play a crucial role in supporting brain health and potentially slowing down the progression of MCI. Remember those risk factors we talked about?
The two sides of the coin idea.
Exactly. Addressing those modifiable risk factors is like taking control of your brain health destiny by incorporating healthy habits into your daily life. You're actively supporting your cognitive function.
Okay, so let's break that down a little further. What are some concrete steps people can take in terms of lifestyle changes to make a real difference?
Physical activity is a great place to start. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week.
So think brisk walking, swimming, or even dancing for a good chunk of time most days of the week.
Yeah.
Got it. What about the food we eat?
Think Mediterranean diet. Lots of fruits, veggies, whole grains, and healthy fats like olive oil and nuts. Try to limit saturated and trans fats and processed foods.
So it's delicious and brain boosting. What about keeping our brain cells active and engaged?
Mental stimulation is key. Challenge yourself with puzzles, learn a new language, pick up a musical instrument, or do any activity that keeps your mind sharp and engaged.
So keep that curiosity alive and never stop learning. It's about more than just crossword puzzles, right? What about our social lives? Do connections with other people play a role in brain health too?
Absolutely. Stay connected with loved ones, participate in social activities, and consider joining groups or clubs that interest you.
It really does seem like a holistic approach is key. Taking care of your body, mind, and social life all contribute to a healthy brain. Now, I've heard a lot about supplements and brain health. Are there any specific supplements that are proven to prevent or slow down cognitive decline?
Unfortunately, there's no magic pill, while some supplements like omega-3 fatty acids and vitamin E show potential benefits. We need more research to be sure and to figure out the right doses.
So talk to your doctor before starting any new supplements, speaking of medications. What about the possibility that some drugs people are taking might actually be contributing to their cognitive issues? How can our listeners know if this might be happening to them?
That's a very important point. Pay close attention to any changes in your thinking or memory that happen around the time you start a new medication or change the dosage of one. You're already taking certain sleep aids, antihistamines, anxiety medications, and even some pain relievers are known to sometimes cause side effects that resemble MCI symptoms.
So it's about being aware of any patterns or changes that seem linked to your medications. What should you do if you suspect your meds might be affecting your cognition?
Don't panic and stop taking anything without talking to your doctor first. They can assess the situation and see if adjusting the medication or finding an alternative is the best course of action.
That's a crucial reminder. We're giving you information here, not medical advice.
Yeah.
So always consult with your healthcare provider for personalized guidance.
Exactly. Open communication with your doctor is key.
Welcome back to our deep dive. It's the final part of our exploration of mild cognitive impairment. And, we've really dug into the science, the diagnosis, potential treatments. But now I think it's important to talk about the human side of this condition, like the emotional and practical challenges that folks with MCI and their families are often facing.
Yeah, absolutely. A diagnosis of MCI can be emotionally really tough, both for the person receiving it and for their loved ones. And it's completely normal to feel a whole mix of emotions, fear, anxiety, sadness, maybe even anger.
It's kind of like this curveball life throws at you, and sometimes it's hard to know how to even process it all.
Yeah.
What advice would you give to people who are grappling with these difficult emotions?
Yeah. I think the first thing is just allow yourself to feel those emotions. Don't try to bottle them up or pretend they're not there. It's okay to grieve the changes that you're experiencing. And it's also so important to reach out for support.
Yeah.
Talk to your loved ones, find a support group, maybe even seek guidance from a therapist or counselor. Sharing your experience with others who really get it can make such a difference.
Yeah, that's a good reminder. You're not alone in this.
Yeah.
What about the practical side of things? Are there tips for people with MCI on how to maintain their independence and manage daily tasks?
Creating routines and sticking to them as much as possible can be super helpful. It provides that structure and predictability, which can be really beneficial when memory and organization become more challenging. And don't be afraid to use memory aids like writing things down, setting reminders on your phone, using visual cues like sticky notes or color-coded labels, anything that helps.
Those are really good practical strategies. But what about those times when memory lapses happen in social situations? I imagine that can be embarrassing or frustrating for both the person with MCI and those around them.
You're right, those can be tricky situations. I think the best approach is just open communication. Let your friends and family know about your diagnosis and how they can best support you. You might say something like, sometimes I have trouble remembering names, so please don't be offended if I ask you to remind me.
Right, so it's kind of about educating those around you and giving them the tools to be supportive. What advice would you give to loved ones on how to provide that support without being overbearing?
I think patience and understanding are key for Kelcham when it's needed, but also encourage independence whenever possible. Focus on the person's strengths and abilities rather than their limitations. And sometimes the best support is simply being present, listening, and offering a shoulder to lean on.
Yeah, it's about striking that balance between providing support and respecting the individual's autonomy. So, as we wrap up this deep dive into MCI, any final thoughts or words of wisdom you'd like to leave our listeners with?
I want to emphasize that a diagnosis of MCI is not the end. It's a journey. And while there will be challenges along the way, there are also opportunities for growth, resilience, and meaningful connections. Focus on the things you can control, embrace the support of your loved ones, and never lose hope.
That's a really powerful and encouraging message. We've covered a lot of ground in our exploration of mild cognitive impairment, from the science to the personal experiences. And if you're facing MCI either personally or as a loved one, remember, you're not alone. There are resources available, research is ongoing, and hope remains.
And knowledge is power. The more we understand about MCI, the better equipped we are to navigate its challenges and embrace the possibilities that still lie ahead.
Thank you so much for joining us on this deep dive into mild cognitive impairment. We hope it's been informative and empowering. Until next time, stay curious, stay engaged, and keep those brains healthy.